band-over bypass. This is really a type of revision operation if someone has previously had a Roux-en-Y gastric bypass operation. Nowadays, I think you have to be humble about attacking this obesity problem and realize that we do not have all the answers. We're searching for the very best tools that will help people lose weight and keep it off. The gastric bypass has been very successful, but there are at least 10, if not 20 or 30% of people who do regain weight over the years, over many years. And so what to do for those folks? Well, there are various revision procedures that have been crafted and that I've done many different versions of. But one that has been quite successful and that has many advantages is to place a lap band over the existing gastric bypass, the so-called band-over bypass. This got a lot of notoriety recently because Carney Wilson had a band-over bypass. After having undergone gastric bypass surgery some years ago, struggled with weight regain. She's now undergone a lap band surgery as a band-over bypass and has once again been successful in losing a lot of weight. So what it involves is basically a minimally invasive operation in the vast majority of cases, a laparoscopy. It can usually be done as an outpatient procedure, and the lap band is placed up around the upper portion of the stomach pouch, just as we normally would place a lap band. And the access port is placed on the abdominal wall just as we would normally do. And so, in the best case, it confers the best advantages of the lap band, its adjustability, its reversibility, and the sense of satiety, the sense of fullness, the decrease of appetite that people experience, and the successful weight loss that people experience. And yet, one still has the advantages of the bypass present too, which is some reduction of calorie absorption due to the bypass, and the overall smaller stomach capacity because of the small stomach pouch. So if there are pros and cons of the band-over bypass, I would say the pros are that almost always I can perform the procedure with a laparoscopy as an outpatient. I do think that it's been very successful in the vast majority of patients. I would say the cons are that it is certainly not a perfect magical solution. It is not a panacea for everyone. It still takes hard work. It still takes effort to lose those pounds and keep them off. It's best done in conjunction with a really determined program to use the protein shakes, to work hard at walking and exercise, and have a plan for keeping those pounds off over the long term. But all in all, is it the best revision operation for someone who has regained weight? Probably so, although there may be arguments for some other choices. But I think the combination of its low invasiveness and its high success rate make it the best procedure for many people.